Welcome to Schuylkill Health in Pottsville, where surgeons have been using amazing new technology for gynecology, urology, and general surgery. It's called the DaVinci Robotic Surgery System, the most advanced kind of surgical technology available, and it's right here in Schuylkill County. Doctors recently introduced the DaVinci Robotic Surgical System at Schuylkill Health's South Jackson Street Medical Center.
The robotic-assisted surgery that we've been using here now at Schuylkill Medical Center is a fantastic advancement, for the community. It's a fantastic advancement for the surgeons. I believe the outcomes are going to be proven to be superior to open surgery because the detail that we see with robotic surgery helps us keep a better, well-controlled field as far as bleeding. The detail and the precision in the movements and the instruments that we use are enhanced with robotic surgery, and that absolutely helps the patient, and it's going to help the surgical outcomes also.
The patients that I've performed the robotic procedure on so far all have been very happy. Number one, with the short hospital stay. Number two, with the lack of pain after the surgical procedure, or markedly less pain than they've had with prior operative procedures. And the fact that they're able to get back to their activities of daily living and their jobs a lot sooner than traditional surgery.
The robotic surgery is really nice for patients because it provides them the newest technology to get the best outcome for their procedure. Patients do much better with a robotic laparoscopic surgery. There's less of a risk of them having to convert to an open procedure, which obviously would entail a lot more recovery for them, both time-wise as well as pain and discomfort.
If you look at it as an instrument that simply is an extension of the skill set that the surgeon has, it provides an amazing capability, particularly, at least from the gynecologic perspective, particularly in specific areas. It's an excellent way to do a complete hysterectomy on a patient and have them walk out of the hospital either the same night or the next morning, and within 2 weeks be fully recovered from their surgical procedure and back to normal function. Patients generally seem to have less pain, less discomfort overall. They're back to their full function a lot faster. And I don't need to tell you that they're super happy about that.
I think the biggest advantage is the vision. It's HD, 3D, 1080p. It's better than the naked eye. The anatomy is just so clear that it really is striking. The way it can move the instruments, you can make it all sorts of angles, you can magnify it, you can do all sorts of maneuvers with a robot.
It will take the laparoscopic surgery that we do and take it to the next level by increasing the cases that we can do in that manner. We can now, because of the robot, do more complicated cases in that manner. In the past, a lot of those patients may have ended up having a large incision and a longer hospital stay.
They're surprised that as a small community hospital like ours that we have this technology to provide for the patients, and that's a little unusual, but it's certainly great for our community. They want to have their procedures close to home, and this gives them the ability to have everything that they would have at a bigger institution right here at home. So this is the basic console that we work from as a physician. There's a chair seated here. We work. All of these pieces move independently, so you can sit at this console in a very comfortable manner, whether you're 5'2" or 6'5". The eyepieces are here. You look into this area. Once you put your head into the machine, it engages the arms, and these instruments down here are how you control the arms with these finger grips, and these finger grips move just like your hand would move. And then the foot pedal at the bottom is used to either move the camera, the one on the left, or the two on the right will provide the energy to the instruments that you're using for cutting or coagulating the vessels that you're doing surgery on. So this is the robotic system itself. One of the arms is always holding the camera. This can be moved in for very, very close visualization. And then the other 2 or 3 arms are where you're going to have your instruments. These are the instruments. They all have different types of instrument on the end, although the general body of the instrument is the same. Some of these instruments are just used for grasping, some are used for coagulating, some are scissors, some instruments you can coagulate and then cut all at the same time. And then this is our camera tower. There's 2 of these in the OR. The screens that you can see to operate. All of the instrumentation and all of the power that goes to the DaVinci is all loaded onto this one cart.
You know, we used to have ladies come to our office and say, well, what about doing my surgery robotically? And of course we didn't have a robot, so we would say, well, you don't need the robot to do that. We can do that the old-fashioned way. Now, we don't have to say that. You know, we have the cutting-edge robotic technology right here in Schuylkill County. The tiny little motions that I'm doing translate into the swing of those arms at the level of the patient. And by just simply going like this with my hands, I'm able to zoom in and I can see the little dimples that in this practice dummy that's supposed to represent skin. I can see each little dimple, each little flaw. I can see each little thread in this suture, which is a level of magnification and precision. Like I can actually peel off each little thread that makes up this suture, which is just crazy remarkable how much I'm able to magnify that view. So you can imagine that inside a patient's belly, with these tiny little motions of my hands and the kind of the swinging of those arms over there, we're able to do super precise surgical procedures. So when talking about endometriosis, I'm able to zoom in, I can bring in the camera, I can get super close to an implantation of endometriosis, and then with just some gentle traction and using maybe a scissors instrument, I'm able to cut out that implantation almost without having any bleeding at all, because you can actually see the blood vessels. If you look over here, just looking at this sample skin, which is of course not real skin, you can see these little teeny lines in here. You can imagine those lines are blood vessels. Well, I can actually see them with my eyes looking through the console at a level at which I would never be able to see with the naked eye.
Being able to come and having this technology available in a community hospital like our hospital here at Schuylkill Health puts us at a distinct advantage. And our main goal is to be a great community hospital, but still at the same time continue and stay ahead of the surgical curve and stay on the cutting edge of the advances in medicine.
Major advantage, there's no travel if you have it locally. You don't have to worry about follow-up care, you know, out of the county. That can always be done right here, you know, by the surgeons who are doing the robot here in Schuylkill County.